Situations where we do not like to use systemic hormone therapy, specifically systemic estrogen therapy. And that is primarily in pregnancy. So just because someone doesn't have a period doesn't mean they're in menopause. You've got to always think about pregnancy. Undiagnosed vaginal bleeding, because a certain small percent of the time it's going to be uterine cancer, which generally is very sensitive to estrogen and would grow under that circumstance. Estrogen receptor positive breast cancer undergoing active treatment, we generally do not use systemic estrogen. And then finally, the biggest risk with using any type of hormone therapy, be it birth control hormones or postmenopausal hormone therapy, is the rare risk of blood clot. So someone with a history of blood clots or actively having clots, we would not use it. In general, if someone is 10 to 15 years past the age of menopause, we don't consider just using it for preventive purposes, because in much older women, like over age 70, there is an increased risk of blood clot and potentially heart attack and vascular disease. In women over age 65 who've been in menopause for a long time, there's a slight increased risk of stroke and potential memory loss. But those risks do not apply to recently menopausal women or young women who've had premature menopause. And every day it seems like I see someone in my office who's suffered and has not been offered hormone therapy because the doctor thinks there's a contraindication, like they have migraine headaches. That's not a contraindication to using menopausal hormone therapy. Maybe you might not use it in women with giving them birth control pills if they have complex migraines, but that doesn't apply to menopausal hormones. Smokers, we don't want anyone to smoke, and we certainly don't want to give the birth control pill to women over age 35 who smoke. But if you're a menopausal woman who smokes, we still can prescribe menopausal hormone therapy.